WALB News 10 presents Dialogue, a weekly public affairs program exploring community concerns and spotlighting regional activities.
Well, on this Sunday's Dialogue, I am getting to meet and know and talk with an Albany native who I'm calling a hero during this COVID-19 pandemic. She graduated from Albany High, the class of 1997, and she is now a pediatric emergency medicine physician and an injury prevention researcher at Children's National Hospital in Washington, D.C. And so I am just so pleased to have the opportunity to talk with Sadiqa Kendi. Welcome. Good to meet you.
Thank you. So nice to meet you too.
The reason your name even came up on my radar is because two people here in Albany saw your husband on another network one morning, and towards the end of his interview, he was talking about Albany, Georgia, his wife's hometown, and we will talk about him in just a minute. But from where you are in D.C., I know that you've got family still here, you've got friends. Talk about your reaction to the impact of COVID-19, here in Albany and the people you grew up with.
You know, it's been really challenging for me as I have thought about all of the people who are suffering in Albany and heard about friends, family members who have either been social distancing and, hearing about other folks in town who've been either really sick, admitted to the hospital, and even some who've died. It's been really hard to watch from afar. Albany has a special place in my heart. I was born and raised there. And as you said, I still have quite a bit of family and friends there. And so it's been really hard, especially as a healthcare provider, to, basically stand on the sidelines from out of town, really far away, and watch my hometown and so many people who I love and care about, that suffer in the way that people in my hometown have been suffering.
That on top of what you do in your daily work as well, you are a physician. You work more with children, but you've been expanding your caregiving, I believe, to even older children and younger adults.
That's true. So as many children's hospitals have done, we've actually expanded the age that we're willing to see at Children's National Hospital, partly because since COVID-19 has affected older people and adults in general more than children, we're trying to just do our part to make sure that we can help to support families, to support adults who are getting very sick, and to support other hospitals who primarily see adults. As a children's hospital, we primarily take care of children, but we have worked to expand that skill set to be able to also take care of young adults who are very ill from COVID-19.
And speaking of children, this mysterious new illness that seems, I believe the latest numbers on the day that we're actually taping this, there were at least 85 cases across the nation where the kids are getting sick, and there could be a connection to COVID-19. Have you seen any of those cases?
So I haven't seen any of those cases personally, but I have been speaking about those cases with colleagues. We have seen some cases at Children's National, and it's presenting similar to an illness that we've seen in the past called Kawasaki disease. But the thought is that it is related to COVID-19, and it is actually making children very ill. The good thing is that we're not seeing really large numbers of children who are coming in with it, but we're seeing enough that we are taking note. We're talking about the best ways to treat these patients, the best ways to make sure we're picking these cases up and treating them appropriately.
So you know that Georgia, specifically Albany, Georgia, has been, in the spotlight, not in a good way, because of the numbers of coronavirus cases and deaths that we've had here. So we have already started to ease some of the restrictions in terms of restaurants and beauty salons and barbershops and other places where people gather. What is your situation in DC? Are you a hotspot now, and are you easing your social distancing guidelines?
We still are not, I wouldn't consider us a hotspot necessarily, in that if you look at the number of cases based on the number of people in the area, we're not necessarily a hotspot, but we still have a significant number of cases. And although cases have plateaued, we haven't started to decrease the number of cases yet. And in general, it's really best to make sure that you don't relax those social distancing guidelines until cases have been reduced significantly over a significant period of time. And we're just not there yet. And so at this point, social distancing guidelines have not been relaxed in DC. We're still not sure if this plateau is going to lead to, hopefully it will lead to reduced cases as people continue to social distance. That's the hope. But we're waiting to see what happens in the coming weeks for the government here to make a decision about when social distancing guidelines will start to be relaxed.
Well, because of your interest in children and, just sort of keeping an eye on, behaviors related to medicine, I know that you have concerns, schools are out, students are at home. Parents are now the teachers and the professors. So you've written an article about your concerns about children at home during COVID-19. If you can share some of that, and why did you want to speak to that?
Well, I wanted to speak to that partly because that's my passion. So as you said, I'm an pediatric emergency medicine doctor and an injury prevention researcher. So I think about injuries. I think about how to prevent them. And I know as an injury prevention researcher and expert that there are ways to prevent injuries in children. And so when the pandemic first started, I knew that because kids were at home, we're at home with our 4-year-old, and I know how challenging it is when patterns change, how challenging it is to try to work full time while taking care of a child and supervising, especially a young child. And these are the types of times in which you can start to see more both unintentional and intentional injuries, just because so much has changed. In terms of unintentional injuries, those can result from just a lack of supervision is one issue. It's incredibly hard, and I would say almost impossible, to really work full time and supervise a young child well. And another issue is just when a child is at home for long periods when they're not usually, it makes it hard to make sure you're consistently doing the behaviors that will help to keep that child safe. So one example is medication safety. Our poison control centers have been getting a lot more calls about children either ingesting medicines or cleaning supplies that they're getting into. A lot of people are hoarding cleaning supplies. They have a ton of cleaning supplies that they're hoarding. There are different people in the homes. Sometimes there might be a grandparent staying with a family, and medications are not being locked away, kept out of reach and out of sight. And because of that, a kid who's at home all day and who will get into anything that looks interesting, could get into that medication or get into those cleaning supplies. And so this really is kind of a setup for what is the number one killer of kids, which is injuries. And so that's why I wanted to write about it, because it's something that people often don't think about. And because we know large numbers of children aren't getting ill or getting seriously ill from coronavirus, I wanted to make sure people were aware of this other really hidden danger of coronavirus, which is being at home and kids potentially being injured.
I've got a copy of that article and some of the other things, and we see this from time to time in terms of reminders, tip-overs. You've got your kids are watching TV more. They may feel that they want to go up and touch the TV, and if it's not secured or anchored to the wall, it could tip over and injure them. Also, stairs and windows. You talk about burns, and something that's of concern here in Albany. In fact, so much so, our coroner, Michael Fowler, started a summer drowning prevention program. And this year, unfortunately, because of COVID, we were unable to host that because of the social distancing. But, a lot of people have pools. And so if you are not making sure that your back door or your slide door or whatever door gives access to that pool is locked and secured, your child may, wander out and end up drowning. And again, that's an accident, but it's something that, I guess parents really need to stay on top of.
It definitely is. And even with pools. So you mentioned drowning, and I have seen way too many cases of drowning during my career. I lived in Florida previously, and a lot of people had pools, and it happens way too often. And it's important to remember that when children drown, it doesn't occur the way that they television or in movies. It's very, very quiet. It happens very quickly. It can often happen in under a minute. And so you can imagine if someone is on a conference call, even on social media, on cooking, doing anything, and take their eyes away from that child for a minute or two, that child could actually drown. And so it's important to actually, if you have a pool in your home, to actually have a fence around 4 sides of that pool so that the child can't access it. Because, for example, my 4-year-old has seen us unlock the door enough that she knows exactly how to do it. And so a child that age can figure out how to unlock and open the door. And so you really need a true pool fence around 4 sides of the pool to prevent kids from accessing it.
We need to take a break, but when we come back, I want to talk about what inspired your interest in pediatric medicine. Also to talk about the impact of COVID-19 on the Black community, and that is where we'll talk about your hubby and his work. So stay with us as we continue to meet another hero, one from right here in Albany, Georgia, who's working on the front lines. It just so happens that she lives in D.C., but she hadn't forgotten about her hometown. We'll talk more with her when we come back. Stay with us. And welcome back to Dialogue, everybody. I'm still talking with Dr. Sadiqa Kendi, who is a physician in Washington, D.C. She's a pediatric emergency medicine physician and injury prevention researcher at Children's National Hospital in Washington, D.C. She is from Albany, Georgia, and I've been talking with her this morning about COVID-19, the impact in terms of what she has been witnessing from Albany, Georgia. And so, Dr. Kendi, I know you've talked with your family, but what about your friends? Have you had conversations with them? Are they expressing fear and just really concern about COVID-19?
Yes. So, one of my best friends who I've been friends with since we always debate if it was first grade or second grade. We're not really sure, but one of my best friends is still there. And so we talk regularly. And I have a couple of other good friends who are still there. And it's really hard to hear from them, the challenges between the fear, just because numbers are so high, knowing that the healthcare system there has been really stretched thin to be able to take good care of all of the patients who have gotten really sick. It's a huge issue, and it has been really challenging to hear those stories, and to know that I can't fix it. I can't fix it now, and that's really been my challenge during this time.
You hear about the possibility that we'll see COVID again, maybe in the fall or some later time. So what are your conversations with other physicians, with other teams, as you look beyond what's happening right now?
We're listening to the experts, and there are a lot of modeling programs out there, a lot of groups who are really looking at what the behavior of the virus has been so far and starting to anticipate what it will look like. The challenge is that because this is a completely new strain of the virus, we really don't know exactly how it will behave. But based on what's been seen so far, my concern and the concern of colleagues is that this will not be the end of it, that especially if we continue to relax social distancing, as it's been relaxed, I think fairly early in Georgia and many other areas, that we are going to see an uptick in cases, and that we'll continue to see cases, and then might even see cases again, as you said, in the fall or later in another season. But I'm concerned this will not be the end of it.
And what about schools? I know I recently talked with our school superintendent here in Dougherty County, and so they've got 3 options that they have on the table. One of which is the option that there may be virtual learning, and that may be across the nation, because there are some parents, I'm sure, a little nervous about sending their children back to school where you're in those settings and you're not 6 feet, separated by 6 feet or whatever. So what are those conversations like in terms of school?
Well, those are really challenging conversations because school is such an important thing for kids, right? Both for learning, for socialization, but we also want to make sure we're keeping our kids safe. And so, those are really challenging conversations because there's so many factors that have to be considered. I know there have been a lot of discussions about allowing kids to go back, but keeping the kind of having desks 6 feet away, for example. But it's kids are kids, and they want to socialize with each other. They want to play with each other. And so the idea of having them in an area where they are in school and thinking that they would really stay 6 feet apart from each other all the time is I think an unrealistic expectation. So it's hard to say what the right thing to do is at this point. And I know there are a lot of educators who are discussing this along with public health experts and physicians, because there's so many things to consider here. And I don't know, I don't know what the right answer is.
But as I mentioned during our first segment, you graduated from Albany High School, class of 1997. So when you left Albany and Albany High, take us through your journey and why you chose medicine specifically to work with children.
So let's see, I graduated from Albany High, like you said, in 97, and I went to Spelman College in Atlanta. When I first went to Spelman, I actually initially planned on doing a combined program with Georgia Tech, and I was going to be an engineer. And then after I got started, decided that I actually wanted to be a researcher. And I thought I wanted to be kind of a bench researcher where I would, be in a lab and like find the cure to something. And I did a summer program during one of the summers of during my college career. And during that summer program, they gave us the opportunity to shadow a physician. So most of the program I was doing research, which is what I thought I wanted to do, but found that like the 3 times during that summer that I shadowed the physician was when I was the happiest. It really brought together science. And, I always loved science and kind of wondering how things worked. But I've also always loved people. And so being a physician, I saw as I shadowed that summer, kind of brought those two together. You meet people, you find out what's going on with them, you try to put the puzzle pieces together, but you get to connect with people. And that connection along with, making a diagnosis and treating people really appealed to me. And that's how I decided to go into medicine.
And then
now in terms,
I was about to say,
sorry,
I know there's more to the story. So then what, after Spelman?
So then I realized, okay, I need to go to medical school. So engineering is not my path. Research is not my path. And so I ended up going to Yale for medical school. And I found I actually enjoyed most of the specialties I rotated through during medical school, partly because I enjoyed the science. I enjoyed interacting with people. But I found I most enjoyed working with children. Children are so resilient and so honest, and it was amazing to see a child could have heart surgery and 2 days later be running around the hall, with their staples still in their chest. And that's just kids, that they, as soon as they can, they will play, they will live, there's so much light in them. And I really enjoyed that. And so that's why I decided to go into pediatrics. I also found that I enjoyed interacting with families. And by taking care of children, it really gave me the opportunity to learn about the family. And in taking care of anyone's kids, you're really taking care of the entire family. I can recommend to a parent to stop smoking because it's best for their child, but honestly, it's also best for them. And so that's why I really decided that pediatrics made sense for me.
And then after Yale, you came, was it Florida?
So after Yale actually was, I did my residency in pediatrics in the Bronx. I was in the Bronx, New York. So a lot of the places I've lived have been really heavily hit. So, the Bronx was heavily hit. And actually the hospital where I did my residency is the Children's Hospital at Montefiore. And they changed their entire pediatric unit to take care of COVID patients. So many of my colleagues who are still there are taking care of adult COVID-19 patients now. From the Bronx, I went to Philadelphia and did a fellowship in pediatric emergency medicine. I really enjoyed primary care pediatrics, but found that I liked the emergency department. I liked the pace of it. I liked that I got to see a lot of different diagnoses and connect with a lot of different families. And so did the fellowship in pediatric emergency medicine. And then from there, I worked as an attending in a few different places. So I was in Rhode Island for a couple years. I was in Florida at that time for a couple years, and then moved here to Washington, D.C.
Well, with that, I need to take another break. But when we come back, I want to talk about your husband's work. And the way since I've learned about you, I sum it up this way. You've come from a family of super achievers. And then you are a super achiever yourself, and then you're married to a super achiever. And many people may be familiar with her husband. We'll talk about him when we come back, and we'll talk more about that portrait unveiling too. So stay with us as I talk more with Albany's own Sadiqa Kendi. And welcome back to Dialogue. I'm still talking with Dr. Sadiqa Kendi, who is from Albany. But when we went to break, we showed you a portrait. Now, this is, many of you may know Dr. Kendi's mother, Sharon Nyota Tucker, who was legal counsel and chief of staff for Albany State University. She was also the first African-American woman to graduate from the University of Georgia's law school. This was in 1974, and that was at a portrait unveiling, I believe it was last year. So congratulations to your super achieving mother as well. And as I mentioned, I consider you a super achiever, overachiever, and then your husband, talk about him, and that is why I connected with you, because he was on, as I mentioned, another network talking about the impact of COVID-19 on Albany. So talk about his work and how the impact on the Black community has been making headlines across the nation.
Sure. So he's a historian, which is really interesting because I have always thought I'm terrible at history, at remembering the years that things happened. But he is very good at kind of looking at history and bringing history to the present and kind of helping us to remember things that happened and to help us prepare for the future. And so he has written a few books about race and history. So Stamped from the Beginning is one that came out a few years ago, and then How to Be an Anti-Racist came out, I guess, about a year ago now, and most recently a young adult version of Stamped. And in those books, he talks a lot about racist ideas and the history of racist ideas. And How to Be an Anti-Racist, he really kind of brings it to the present and talks a lot about his personal story. And you'll see I'm in there. I think my mom is in there as well. But, in that work, he really looks at racist ideas and the history of racism in this country and how it's affected so many aspects of the Black experience in this country. And
let me just let me give him a shout out. He won the 2016 National Book Award for Nonfiction. Ibram X. Kendi. Mm-hmm. So congratulations to him. And again, thank you for what you are doing. And we're running out of time, so that's why I'm having to sort of wind things up. But hopefully one day I'll get to interview both of you to talk about his work and more on the other side of COVID-19. And keep Albany in your thoughts and prayers, please, and stay in touch with us. Thank you so much. Again, you can follow you on social media? You're on Facebook, I believe. Sadiqa Kendi, doctor in Washington, D.C., but an Albany native, and we're so proud of you and what you're doing, the work that you and your husband are doing. Thank you so much, and have a wonderful Sunday, everybody.